Are you over the age of 50? Do you wear contact lenses? Look at computer screens for a long time without a break? Do you spend time in air-conditioned or heated environments? Or expose your eyes to windy, cold, dry, or dusty conditions? Do you smoke or drink alcohol? Or take certain medications? For example, some antidepressants or blood pressure medications. You may likely get a common eye condition called dry eye. Dry eye happens when your eyes don't make enough tears to stay wet, or when your tears don't work correctly. This can make your eyes feel uncomfortable, and in some cases, it can also cause vision problems. You are more likely to be at risk if you do not get enough vitamin A that is found in foods like carrots, broccoli, and liver, or omega-3 fatty acids, also found in fish, walnuts, and vegetable oils. Today on your regular health TV talk show, The Physicians, we'll be discussing common eye condition, dry eye.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Daravite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Daravite from LB Pharma. Daravite, love yourself.
It's another day with the Physicians, where your health is our business. My name is Dr. Martina Agberia, your anchor for this program for today. We'll be discussing common eye condition, dry eye. In the studio, I have a guest. She is a consultant ophthalmologist, a professor of ophthalmology with the College of Medicine, University of Lagos. She's no other person than our very delectable, intelligent, very cerebral consultant. She is Professor Adeola Onakoya. You're welcome to our program.
Thank you for having me.
You're looking really good as usual.
Thank you. I'm glad to be here today.
You're welcome. Thank you so much.
Yes, thank
you.
So,
you know, we're going to be talking about the common eye condition, dry eye. Maybe you want to give a general overview of the eye, so at least so that people will understand why an individual can actually have a dry eye. General overview, then we'll know where the challenge will come from.
In actual fact, you have given a general overview of what a dry eye is all about. But to learn more, dry eye, as we say it, it's an eye that is dry. But what are those circumstances, or what are those situations that can lead to the dryness of the eye? Firstly, let me explain the situation around the eye. When we talk about dryness in the eye, we are considering those parts of the eye that are responsible for this. Firstly, in the eye, the ability of the eye to see very well is dependent on the presence of the tear, which we refer to as the tear film. And the tear film, what it does is to lubricate the surface of the eye such that from time to time your vision is clearer. Because that part of the eye, which we refer to as the cornea, needs to be transparent, needs to be clear for you to be able to see very well. And if it's not adequately lubricated, then your vision will be blurry, which is why sometimes when your vision is blurry and you blink a few times, it becomes clearer, because now you have lubricated over the cornea and you've cleared out all the possible debris that may be lying on that part of the eye. Now, apart from the cornea, we also have the conjunctiva, which we all know. That is the part of the eye that goes red when you have Apollo, when you have an injury in the eye, or when we say we have conjunctivitis. It is transparent membrane. But therein lies the tear gland, part of the tear gland, the structure that produces part of the tear. But apart from that, we also have what is called the lacrimal gland, which is situated in a corner on the outer side of the eye, in the orbit, on the outer side there. and that is what produces the watery component of the tear. In actual fact, the tear is, in 3 parts, but now it's been grouped into 2. We have one part, which is the oily part, which we get from the eyelids, and then the 2 other parts are from the surface of the eye, from this conjunctiva and from the lacrimal gland. We have different tiny, tiny glands also that contribute to the production of this tear component. For the oily part, which I said is from the eyelid, and that is from the meibomian gland, is the oily part of the tear film, and is the one that we have on the surface. And then the watery or the liquid part is we have largely from the lacrimal gland. When people cry or when you laugh and water comes out of your eye, which is referred to as reflex tearing, that is produced by the lacrimal gland, and that is the watery part of it. And then there's another part which is known as the mucin. It's like mucus, yes. And that is the innermost part of the tear. That is the part that sticks on to that cornea and enables the tear film to stay on the surface of the eye. So those 3 components, the oily part is separate, and then we have the mucus and the watery part together. Now the oily part, what it does, if you have oil on the surface of water, it prevents evaporation of that water. So that's the way the tear film is. You have the oily part on the surface of the watery part, and the mucus part is the one that attaches or adhered to the eyeball, for you to be able to see well and to lubricate the eye, for the eye to be wet. Because the normal condition is for the eye to be wet, for you to be comfortable. Because if you don't have enough tear, maybe the lacrimal gland, which is the one that produces the watery part, is not working perfectly, as we have in some other systemic conditions. There are conditions that may affect the body, affect the lacrimal gland, affect the salivary gland, whereby you're not making enough tear, you're not making enough saliva, your mouth is dry, your eye is dry, that is there. Or if there is a situation whereby you have an infection or inflammation or a disorder of the eyelid which affects that meibomian gland, which produces the oily part, then you know that you won't have enough of that oil on the surface of the liquid part. So the air, the wind blows off the little that you have on the surface of the eye, hence the eye goes dry. And once your eye is dry, you feel very uncomfortable. You have this sandy feeling as if there is grit in the eye. It's as if somebody has put maybe a sand, or not a sand. Somebody has put an object inside your eye, so you have a foreign body feeling, or you have that gritty feeling. And then as part of the presentation, the eyeball also may be red, which is a response to the irritation that you're feeling. So that is essentially what it is. So we tend to then group the dry eye into the one that we call aqueous deficiency dry eye disease. That is, the liquid part is not available, or it could be as a result of evaporative dry eye disease, meaning the reason why is because the tear that you have just gets dried off because the oily part is not available. Maybe because there is lead infection, you have what we call blepharitis, which is a lead margin infection. All this can affect it, or maybe you're wearing contact lens, which is causing a lot of irritation. Yes. So what are those predisposing factors? Number 1 is age. Because I noticed in your intro, you mentioned, are you 50 years and above? And another risk factor is being female. It's commoner in women than in men, all the problems postmenopausal. By 50, you are postmenopausal, most likely. So that is why, the age 50 is there. So postmenopausal, and also conditions whereby you expose your eye maybe to dry, to wind, in air condition, you're sitting directly in front of the air condition, or when you're driving, the glass is down, a lot of wind is blowing and drying off the tear on the surface of the eye. Or if you open your eye continuously, for instance, when you use the digital devices, the computer, your smartphones, and maybe the tablets, and you are there continuously without blinking, because naturally we are to blink 15 times in a minute. You have to blink, and the blinking helps in the lubrication, just to keep lubricating the eye. So if you're staring continuously, of course, the eye gets dried out, and when it's dried out, you begin to feel uncomfortable. You are straining the eyes even to see better, and then you have what is called the computer vision syndrome. So that is the link. And then also, if you're wearing contact lenses, all this is because the contact lens, what it does is to prevent the lubrication of the cornea. And we have some nerves on the cornea, and it may affect the viability of these nerves. And once those nerves are affected, they are not sensitive enough, because the ability to blink also is dependent on the viability of those nerves. Once those ones are gone, then you are not blinking, the eyes get dried out, and then you have the mucoid parts now, forming debris on surface of the eye. And that is when, once you rub your eye or you blink a few times, you notice that the vision is clearer. That is one good sign to know that what you are experiencing is a dry eye. And sometimes it could be so bad that if your eyes are dry, you feel so uncomfortable, your whole system just goes haywire, and you would not believe that it's because you have a dry eye. Also, it's important to know that there are some systemic conditions, there are some diseases in the body that can also come with the dryness of the eyes.
You said there are some diseases in the body that
Yes.
also comes with the dryness
of the eyes. Yes.
So you just hold it there, because we are going to delve into some of those diseases, to just mention a few. And we need to just keep a date with the physicians. Let us hear what our viewers out there have to say about dry eye. Have you experienced dry eye before? You know the reason why? You know the functions of tears. Are you over 50 years of age? You are actually at risk of coming down with dry eye. We're back after the short break. Stay tuned.
Okay. Any names of any common eye disease don't usually come to mind, but what usually happens to me is that sometimes I tend to have this watery things. Like, for instance, if I don't sleep well at night, it's like as if when I wake up in the morning, like as if they pour a lot of Gary in my eye, so it starts to prick me. So what I have to do is I have to like sleep out the day, you understand, or sometimes I have to like constantly just like rinse it. I don't know if that's right though, but I just, because it's sometimes very, very pricky, like you pour a lot of sand in it, and it's like very, very painful. Sometimes it lasts for like 1-2 days before the thing like fades away. Yeah.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Daravite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Daravite from LB Pharma. Daravite, love yourself.
Welcome back. If you have just joined us, you're on to your regular health TV talk show. The physicians, where your health is our business. We've been discussing common eye disease, dry eye. And in the studio with me, Professor Adeola Onakoya, a consultant ophthalmologist, a professor of ophthalmology with the College of Medicine, University of Lagos, has been discussing and telling us a whole lot the importance of tears, that the reason why one can actually come down with dry eye. Are you over 50 years of age? Do you always focus on the computer? Do you expose your eyes to harsh conditions, wind, air conditioners, and so on, and so many other things she has said. And before we went to break, we actually wanted to talk about some of the diseases that actually could present associated with dry eye. We want to just continue from that point.
Yes, there are diseases that may present with dry eyes, dryness in the eyes. The first one is called Sjogren disease. And this Sjogren disease, apart from the dryness of the eye, the salivary gland, where we produce saliva from, also is affected. It's a form of autoimmune disease. Okay. And so such individuals will come with dryness of the eye, with all this complaint. My eyes, it's as if, somebody poured sand in the eye, or the eyes are red. I feel there's something in my eye. And also, I find it difficult to swallow, because my mouth is dry. I have to keep drinking water. Other parts of the body also where you expect fluid may also be dry. The genital area in women, it may also be dry. So that is Sjogren disease. Okay. Now there are the non-Sjogren disease, like people who have what we call the connective tissue disorders, like lupus, people who also experience diseases, like rheumatoid arthritis, they also may present with dry eyes. Now, apart from that, you may also have, this simile infection of the eyelid, that may also present with dry eyes, some other things, just causing dryness in the eyes. So we have to be wary of those ones, those disorders, apart from all these other conditions that we have control over, like sitting in front of the air conditions or sitting in a room where the fan is directed at you. Of course, it's going to blow off all the tear in the eye. And also prolonged staring on the screen, smartphone, the digital devices, all this, can result into the dry eyes. Okay. And, I spoke about the one of the eyelid infection, which we call meibomian gland dysfunction, which would have to be treated by the doctor.
So, Prof, you have mentioned all the things that are likely to cause the dry eye.
Yes.
Risk factors also.
Yes.
Now, people out there are wondering, how do I know? What are they presenting, saying? What are the complaints? What was the individual feel to know that I'm probably having a dry eye?
Yes. One common complaint or symptom is if you have intermittent blurring of your vision. You just discover that your vision just goes. You are not seeing well. But after rubbing your eyes or blinking a few times, then the vision returns. That is one of the common symptoms of a dry eye. And of course, the other symptoms are the irritation, redness, gritty sensation. Sometimes it may be a bit itchy. But if you have a lot of itchiness or itching, that is allergy. So you may have the two coexisting, allergy and dryness. Of course, the allergy, if you have allergic conjunctivitis, it can also lead to a dry eye and other infections in the eye. I also need to mention that there are some medication that we may be taking that may also lead to dryness of the eye, like the antidepressants, as you mentioned. Patients who are taking this have to be on the lookout, and when they experience this dryness, they tell their doctor, and the appropriate intervention will be given. Okay. Yes.
Now you have made mention of all these ones. We now know the predisposing factors, the risk factors, we know the symptoms, and they are all wondering, okay, I have all these. What's next? The management. How is it going to be managed?
Well, what next? We have to be very careful there, because you don't want people to be self-medicating. It's always important, if you have such complaint, want to see the eye doctor. However, if you see your doctor and it's a straightforward dryness of the eye, probably because of the age, particularly in women, because of it's one of the postmenopausal signs, then you can just get lubricants, just to put lubricants in the eye. But sometimes it may be more than that, which is why you need to see an eye specialist and let them examine you and be sure that it's just the the usual dryness of the eye. And then you also have to take precautions, make sure you're not staring for so long on the computer. There is the 20-20 rule, stop for 20 seconds, every 20 minutes, and look far at 20 feet. That's the 20-20 rule. Meaning, when you're working for so long on the digital devices, you have to stop intermittently, take a break, blink, and make sure you are blinking about 15 times in a minute. The ability to do that also depends on those nerves. So, I mentioned some nerves. If those nerves also are damaged, maybe from trauma or maybe a central problem in the brain, such individuals also may have problem of dryness. In fact, there are some dryness that would not necessarily cause redness of the eye. And when such eyes are dry, what it gives you is severe ache in the eye. You feel a lot of pain in your eye. It's as if the eyeball is drawing. Sometimes you may actually feel it right through into your head. That is the one that we refer to as neuropathic pain because of problems in the nerve that supplies the cornea, which is what is causing the dryness.
Prof, time is not always our friend.
Yes.
Whenever we have you in our studio. But before you leave, the final word, I want you to just emphasize that 20-20 rule.
Yes.
That's your final word.
Yes, that if you have working on the digital devices, you must take breaks. After 20 minutes, you must look farther for 6 feet, 6 meters or 20 feet for 20 seconds. Take it off for 20 seconds. Every 20 minutes, look at 20 feet. That's the 20-20-20 rule. Just make sure you are closing your eyes, blinking.
And how many times does a human being supposed to blink in a minute?
15 times.
You are expected to
in
blink
a minute.
15 times in a minute.
Yes.
How many times have you done that?
Today.
Just watching this program.
Yes.
So, Prof, thank you so much for coming
It's
again
my pleasure.
on our program, and you've actually schooled us and told us so much about the dry eye. If nothing else, I'm sure my viewers out there have taken in the number of times they're supposed to blink.
Yes.
And the 20-20 rule.
Yes.
I want to really appreciate you for coming, and till next time, I'm sure whenever we call again, you'll try please on our invitation.
Thank you so very
and
much for having me.
I'm sure you've actually heard it from the professor herself. Remember the 20-20 rule. Also ensure you don't put your eyes on the computer a couple of times. If you are working on the system, stand up for a minute, walk about, come back, just blink also, just exercise your eyes. And do not expose your eyes to the direct air conditioner and to harsh conditions. On this note, I want to say thank you so much for being part of our program again this week. For next week, ensure you don't watch this program alone. Call somebody, call your family, so you can all watch. Call friends, so you can watch and enjoy everything that we have to tell you. And if you have been missing out on the physicians, you can actually go on our website. The YouTube we have over 250 episodes on YouTube that you can actually listen to. Just binge. If you want to be part of this program, they're just a stone throw away. Go to our website and you have the form. Just complete the form. I'll be here like Professor Onakoya to come and be our guest. My name remains Dr. Martina Agberie. I'll see you again next week. Stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.